Hi, my name is Dr. Eboni Webb. I'm a clinical psychologist based in Nashville, Tennessee, and I have this practice where I work with clients and families that have suffered trauma, personality disorders, suicidal ideation, self-harm. We really cover the whole gamut of people that we serve. And in my work, I have been so deeply inspired to be able to address the complexity of healing. And not just healing from depression and anxiety, but often very troubled childhoods. And so it took me on a journey of getting certified in various techniques. I came into my work being fully trained in dialectical behavior therapy. And in this series, we're going to talk a bit about DBT or dialectical behavior therapy. But when I started working with clients that had this really complex, traumatized childhood, I realized that many of the tools of DBT could not tap into what was deeply needed to heal from the past. The present is important, but the past was definitely informing present moment experiences. So a colleague of mine came to me and suggested, hey, I think you ought to be trained in sensory motor psychotherapy. I'd never heard of this term, and so I started researching. And what I came to understand about sensory motor psychotherapy is that it came from this field of somatic therapies or body-based approaches. And I spent about 5 years getting certified in that form of therapy. And what I came to understand is truly like the book by Dr. Bessel van der Kolk, the body does indeed keep the score. And I came to understand that so much of what my clients loved about DBT also became their inner critic, because as soon as they left my office, they would be emotionally hijacked. And that emotional hijacking was stopping their ability to retaining the information that they had learned in skills classes and in our individual sessions. So I had to understand, how do I address that emotional hijacking? It's not just an intellectual or cognitive pursuit, but a full body-based experience. Because as you will come to understand in this series, emotions are the language of the body. And I really needed my clients to develop an emotional body-based literacy. And that is exactly what sensory motor psychotherapy provided for me, a way to address tools and strategies with clients that help them learn the language of their body. And so in that work, I had this robust treatment approach. So DBT can be what we think of as a top-down process, and sensory motor psychotherapy can be thought of as a bottom-up process, which we will explain in greater detail. So in this series, we're going to be talking about the integration of both DBT and sensory motor psychotherapy into what I like to call embodied DBT. And in this series, Embodied DBT, Skills and Strategies to Address Traumatized Clients, we're going to first define what it is to embody, right, these techniques and bring this embodied DBT to clients. Then we're going to really talk about what is trauma. What is the difference between post-traumatic stress disorder to complex post-traumatic stress disorder and everything that occurs in between. But then we're also going to talk about real-world skills, strategies, and a really deep toolkit to address the complexity of healing from trauma, not just in your sessions, but ideally for the client to take away throughout the course of their life. And that really requires therapists to be willing to embody the skills themselves first, to model what healing looks like, what self-care looks like, so that clients really latch onto that. And that requires a real-world therapeutic relationship. And so in this series, we're going to talk about the various techniques and strategies that therapists need to employ in order to be more effective with their clients, which is something that I had to learn as well. So I'm so excited to have you join me in this series, lesson by lesson, as we do this deep dive into what it is to practice embodied DBT.